Good morning everyone. Today's our class is on pit and fissure sealants. So what is a pit and fissure sealant? As you can see on the screen, pit and fissure sealant it is used to describe a material that is introduced into occlusal pits and fissures. It forms a micromechanical bond, protects the tooth from the caries. So coming to the brief history of pit and fissure sealant, in 1867 Arthur stated that decay is inevitable. Like, we cannot say that a decay cannot be avoided. It cannot be avoided, it can be prevented. So he gave the concept that it cannot be avoided, so it can be prevented in 1867. 1905 Millard introduced the concept that he used silver nitrate for caries prevention. 1922 Hayat, he told a concept of prophylactic odontotomy. This is a concept wherein the occlusal surfaces of the teeth are modified so that they become less retentive to food, and thus it helps in the prevention of caries. And lastly, Gore advised the use of polymers for sealing the pits and fissures. In 1955, Bunocore, he introduced the concept of using a phosphoric acid for acid etching the tooth surface. This way it can increase the retention and the bonding of pit and fissure sealant to the tooth surface. 1965, Bowen gave bis GMA, that is bisphenol A and glycidyl methacrylate. This material is a major ingredient of pit and fissure sealants which we use nowadays. And 1971, NuvaSeal was the first pit and fissure sealant which was introduced in the market. So first, before applying a sealant, we should understand what are the types of pit and fissure sealant. Types of pit and fissures. So there are various types. Like in the first picture you can see, that is a U-shaped pit and fissure. We have V-shaped pit and fissure, then I-shape. There is I and K combined fissure and an inverted Y shape. So the U-shaped fissures, they generally don't need any kind of sealant, but V-shaped also does not need much of it. I-shape, IK shape and Y-shaped pits and fissures, they need to be protected from caries by using sealants. According to the chemical structure of the material which is used for sealants, they are divided broadly into methyl methacrylate based, TEG-DMA, that is triethylene glycol dimethacrylate based, bisphenol dimethacrylate based. Bis-GMA is a reaction product of bisphenol A and glycidyl dimethacrylate with a methyl methacrylate monomer, and propyl methacrylate urethane based polymers. Based on the generations, the sealants are classified into 4 generations. That is, the first generation which is cured by UV light. The second generation is a self-cure pit and fissure sealant. The third generation of pit and fissure sealant was introduced, which can be cured with light. And finally, the fourth generation of pit and fissure sealant is which releases fluoride. So we have shown that there are examples like the first generation was NuvaSeal, which was introduced by Koch and Dentsply company. The second generation example is a Concise White, which was introduced by 3M. It is a self-cure. The third generation of sealant was HelioSeal, light cured, and finally the fourth generation of sealant was PulpDent. It is a fluoride releasing sealant. Based on the color, they are divided into clear sealants, opaque sealants and the tinted sealants. Clear sealants are the sealants which after curing they become normal or clear to the tooth structure. Opaque, which appear different from the tooth structure. And tinted, they are a bit in between, that is not opaque, not clear, they are tinted. Based on the curing mechanism, they are classified into autopolymerizing, that is they cure by itself, or a light is used, so they are light cured. It can be UV light or a natural light. And based on the filler content, sealants are divided into unfilled and filled sealants. Coming to the basic requirements of a pit and fissure sealant, the properties which we need to see in order to select a material for a sealant are that it should have a good penetration, that it should penetrate deep into the pits and fissures which we need to protect. The working time should be adequate, it should not be too long or too short. Setting time should be short, so that the material application becomes easier for the doctor. Water sorption should be low. Low water sorption, that is that it dissolves less into the oral cavity, and this gives the life to the sealant. Thermal expansion should be low, that is the expansion of sealant when it is applied into that tooth structure. Wear resistance should be high. Again, if wear resistance is high, then only we can ascertain that a sealant will retain for longer time. And lastly, this will be the final total qualities which we look for in an ideal sealant. Coming to the steps or methodology of application of pit and fissure sealant, as you can see in the picture A, these are the armamentarium which we need, that is a mouth mirror, a tweezer, explorer, brush, microfiber brushes, etc., cotton rolls. You need to isolate the tooth with a rubber dam also before applying a sealant. B picture shows that this is the occlusal surface of the tooth. You can see the discolorations which we need to do the sealant application. The C picture shows that a burr is used to explore all the cavitated slits and fissures. This burr helps in removing any kind of the deep fissures which are there on the tooth surface. The D picture shows that there is acid etching being done. The bluish chemical is, you all know that it is the phosphoric acid. Based on the tooth, we do the etching. Like for the primary teeth, the time of etching is different. For the permanent teeth, it is different. Afterwards, it is the dry frosted appearance which we say that it should be visible after etching. It is washed and dried, and a white frosted appearance is seen. The next picture, F picture, shows that there is a sealant application. We can use a microfiber brush, or as you can see in the picture, we can apply it directly from the tip which comes with the syringe. Light curing is done, and this is the final sealant which is placed onto the tooth. Again, like I previously told, that the etching time of the sealant varies based on the tooth. So the primary tooth, it is recommended that 30 seconds should be the etching time. For the permanent tooth, 20 seconds it should be etched. Then it is washed with water for 30 seconds, both primary and permanent. It should be copious irrigation should be done. Copious washing with the water is done, and dried for 15 seconds. Silverstone gave a concept that in 1975, that these are the three kind of zones which are seen after the acid etching. Like there is an enamel surface, this next is the edge zone, then there is a qualitative porous zone, and next is the quantitative porous zone. The yellow part shows that in the porous zone only the resin tags forms which provides the retention to the sealant. So these are the certain critical issues like which we face clinically when applying pit and fissure sealant, or when we are recommending it to the patients also. That is, the first is usage. That is, we know that sealants are technique sensitive. The tooth needs to be isolated properly. So we have to follow the instructions properly, and then only a long lasting sealant can be applied to the tooth surface. Parental attitude towards sealant. Usually most of the time the parents are not so much aware about use of sealants, as the concept is that these are milk teeth, they are anyway going to fall off, or what is the need of sealant. So we need to explain them how it is helpful to the child in the long run, and thus it can be beneficial for them. The physician's knowledge, our medical counterparts are also not very much aware about it. So we have to make them aware also that these are the methods which are available in the market for prevention of dental caries. And lastly, the cost effectiveness of sealant, that is it is a costly procedure or a not so costly procedure. We have to explain to the patient that prevention is better than cure. So in order to prevent a long lasting disease to happen in the oral cavity, we can use the sealants. So lastly, we come on to the various types of the sealants which are available to us in the market. And as you can see that it is a Conceal F. This is a fluoride releasing sealant. It is helpful in releasing fluoride. Heliosil is a clear pit and fissure sealant. That is, it is after curing, it becomes natural. It becomes like the tooth structure only, color of the tooth only. So we cannot, by naked eye, we cannot make out that whether a sealant is applied or not. Dalton Seal and Glow. This is a fluorescing pit and fissure sealant. That is, when a fluorescent light is put on the tooth, then it glows. CleanPro colored pit and fissure sealant. Again, color is a very important thing. Tinted is there, as we told in the previously. We have a clear, so there is a colored pit and fissure sealant, that is CleanPro pit and fissure sealant. Wet bond pit and fissure sealant has come. So pit and fissure sealant is, we know that it is technique sensitive. Isolation is very, very important, and saliva is continue to come into the oral cavity. So this is a newer advantage, that wet bond is bonds to the tooth surface even when there is saliva is there. So wet bond is an advantage to this. AG spit and fissure sealant is the sealant which contains ACP, that is amorphous calcium phosphate, that helps in the remineralization of demineralized tissues. And lastly, Ultraseal XT, this is a hydrophilic, fluorescent also BPA free pit and fissure sealant, that is, it is like wet bond, it bonds to the tooth structure even though moisture is there. Fluorescent, it fluoresces also, and finally it is a BPA free. So these are the various newer advances in pit and fissure sealants. So thank you everyone, that will be all for today. If you have any doubts, you can let me know. Thank you.